Lung cancer, heart disease, stroke. You may know all the reasons to stop smoking, but you still light up. You're not alone. In the United States, 43 million people smoke. 70% of them say they want to quit, but only 5% could stop for 3 or more months. Now, a new national campaign has been launched to provide them with the information they need to finally quit for good. It's called X.
Tobacco is a killer, and it is still the #1 preventable cause of death in America. Kills nearly 400,000 people a year. When I issued the report to Congress in 1988 on the effects of tobacco on health, particularly in reference to addiction, I said then that it was just as addictive as was heroin or cocaine. And it still is just as addictive as heroin as cocaine, and that makes it the #1 preventable cause of death in this country. Nicotine is, no matter what you think about smoking, nicotine is a very remarkable drug.
If you've tried to quit before but didn't succeed, don't give up. For the vast majority of smokers, nicotine addiction is a tough one to break. In fact, on average, smokers take 8 to 11 attempts before they are able to finally quit for good. You can increase your chances for success by taking time before you quit to prepare yourself for what lies ahead. You wouldn't run a marathon without training. To quit smoking for good, you need a comprehensive plan. This is called relearning your life without cigarettes.
I tried to quit maybe once every month for years. Nothing helped, nothing worked. My big moment when I ultimately quit was I met a friend of mine, came out to be a close friend, and she had her mom pass away from breast cancer. Watching her throughout the years go through the chemo and everything, she looked at me and said, you know what, I can't be around somebody who's treating life as a game. You know, that smoking, that's looking at lung cancer in the future. So that was enough ultimatum for me to finally, put the brakes on.
Smokers' chances of quitting successfully are the highest if they use every tool in the arsenal to prepare to quit. First, identify your triggers. Your triggers are things, activities, and moods that make you want to smoke. For many people, cigarettes and coffee go hand in hand. Others may smoke while they drive. Once you identify your triggers, you can develop coping mechanisms to deal with them without relapsing.
For me personally, it was the coffee in the morning and taking the drive with the windows down and a cigarette. Now, I do drive with the radio full blast when usually I didn't. Recently installed the GPS navigator. I love to watch that and just have coffee at different times now. Instead of having it in the morning before I get to work, I'll have it at work now.
The second step is learning how the nicotine in cigarettes affects your brain. You'll see that it's okay to take quit smoking medications to help. Talk with your doctor. He or she can recommend medications that can double your chances of quitting for good.
Cigarettes have all kinds of carcinogens in them. They have things that make your fingernails turn brown, tar, and it is not things like tar or carcinogens that make you want to go back and have a cigarette. It's only the nicotine. When you take an inhalation of cigarette smoke, you are getting all the bad things that give you cancer, etc. But you also are getting nicotine, which says, come on, smoke again. And when you put your cigarette out, the withdrawal symptoms of not having your nicotine begin to say, it's time for another cigarette. There are all kinds of helps that we have for people today who want to quit that weren't available even 5 years ago. So that's really the good news. And the way the doctor can help you first is to pick the aid that we have pharmaceutically now that's fit particularly for your type of personality.
Lastly, surround yourself with supportive friends and family, or go online for community support on websites like becomeanx.org.
Support is big. Counseling from friends, from those who are close to you. Because to this day I still have friends that come around every day and will make the attempt to go out smoking with them or have a cigarette. But you know what? I still associate with them. They're still there, and I've learned to relearn life with them as well.
Quitting isn't easy, but with a plan and preparation, you can do it. And if you do relapse, don't quit trying. On average, it takes 8 to 11 times before most smokers quit for good. So each quit attempt brings you one step closer to success. You can get a free quit plan to relearn your life without cigarettes at becomeanx.org, so you can quit for good. It's time to become an X. The World Health Organization has warned that 1 billion people globally could die from tobacco-related disease in this century if dramatic measures aren't taken to reduce smoking. It is timely that the National Alliance for Tobacco Cessation, comprised of the leading voices in the U.S. public health community, has teamed up to launch X, a free program to help smokers quit. It's the first time in 40 years that so many health groups have aligned to get a smoking cessation message to the public at large.
The X campaign creates an opportunity for people to relearn their lives without cigarettes. It also has 3 components to it. One addresses behavior, understanding how you need to modify your behavior and your life environment to make it less difficult to quit. Second is acknowledging how incredibly addictive cigarettes are and tobacco products, and it provides you with lots of opportunities to understand the different treatments that are out there for you to tackle the addiction. And finally, it helps you understand the critical role social support plays in allowing you not only to quit, but to stay quit. And you can do that through your friends and family, or you can join a support group online at becomeanx.org.
X doesn't tell you why you should quit. It helps you develop your own interactive plan to stop smoking. Based on empirical evidence, clinical expertise from the Mayo Clinic, and practical advice from ex-smokers, X will help you relearn life without cigarettes so you can quit smoking for good. The X website, becomeanx.org, offers a free 3-step plan as well as a connection to an online community of other smokers trying to quit.
I didn't have the luxury of quitting with Become an X, but now I see the process that it's involved in it. My gosh, I mean, I wish I had it. Now I can advocate that to friends and family.
X was created by the American Legacy Foundation, a nonprofit dedicated to helping smokers quit and preventing young people from ever starting. The American Legacy Foundation educates the public about the dangers of tobacco through national campaigns like Truth and helps arm adults who do smoke with the tools to quit.
The X campaign is supported by the National Alliance for Tobacco Cessation. It's a collaborative with 16 states, and they have come together to present this message and to work with citizens all over the United States. It's important for states to get behind a smoking cessation campaign like X because across this nation, 43 million people still smoke. As we look at budgets and the crisis that many states are having as it relates to funding, it's important to keep people healthy because if we do that, then those are dollars that we don't have to spend on the back end when people get sick as a result of all of the illnesses that come with the usage of tobacco.
I know how hard it is. I was once a multi-pack-a-day smoker, as were many members of my family. I finally quit at age 39 on Mother's Day 16 years ago, but I have lost 3 aunts to lung cancer. My mother died of a massive heart attack at age 62, and I've had many other relatives die of other tobacco-related causes. I know with nearly 500,000 Americans dying every year that I am not alone in that situation, that some listeners are in a similar situation. So it behooves them, if they are a smoker, to quit. If they know a smoker, to be supportive and help them quit too. Typically, when someone finally succeeds at quitting, they've had anywhere between 8 to 11 prior attempts. So we view every attempt to quit as one step on the road to ultimately succeeding in quitting.
Relearn life without cigarettes. Visit becomeanx.org.